I'm really pleased to be here, but before I start, I would like to say hello to you all. Did I get that right? Eta, right? Hello to you all. My name is Faatihah, like I've been introduced. And today I'll be talking about physical activity and chronic kidney disease in the perspective of Global South lens. So here is the overview of today's presentation. I'll talk you through what chronic kidney disease is. So most times I'll call it CKD. Then I would explain or describe physical activity and exercise in terms of the recommendation and the clinical guideline. And I would discuss my past project on exercise and physical activity among non-dialysis chronic kidney disease patients. And then I'll give you a talk on Global South lens regarding CKD and regarding physical activity engagement among patients who have chronic kidney disease in the Global South. So what is CKD? It is a global health problem just like type 2 diabetes and hypertension. It is a long-term condition. It takes years to manifest, and it is a list of abnormalities which is clinically oriented, and it results in progressive and irreversible damage to the kidneys. We have two kidneys, so when the symptoms manifest, it shows that the two kidneys are bad, and it results with structural abnormalities, which is identifiable through diagnosis, and functional abnormalities as well. So what is the global prevalence of CKD? CKD is globally a health problem, but it's been shown that there is high burden within the low middle income country, and the Blacks and South Asians have higher risk of developing chronic kidney disease than other ethnic groups. It is more in low middle income country with about 13.8% in terms of the prevalence, and you can find more of such incidences in the urban regions within the low middle income countries and also high middle income countries. The risk factors could be genetic, environmental, and this could be classified as those that you can modify through lifestyle modification, and non-modifiable risk factors, which could be age. Age is a natural risk factor to aging kidney, and family history of type 2 diabetes or hypertension could predispose to chronic kidney disease. Like I said, the Blacks and South Asians are more predisposed to CKD due to genetic predisposition and lifestyle as well. And the modifiable risk factors are poorly treated diabetes, particularly type 2 diabetes, hypertension, and any history of acute kidney injury, and prolonged use of non-steroidal anti-inflammatory drugs, which is more common among Africans due to chronic pain. So CKD is a multiplier of disease. Most often when you see a patient with CKD, it has to carry along type 2 diabetes or cardiovascular disease. So it's very rare to see CKD patients without any of this. So when you see type 2 diabetes, you realize that if it's not well treated, most patients come down with chronic kidney disease and cardiovascular disease. And it's been shown that type 2 diabetes and hypertension are leading causes of end-stage renal disease globally. So we have 5 stages of CKD, from stage 1 to stage 5. A lot of us fall under stage 1 without any clinical symptom, but as it progresses to stage 4, 5, there is severe loss of function, which results in kidney failure and which results in dialysis. In terms of classification of this disease, it is based on the estimated glomerular filtration rate, which is a marker of how the kidney filters blood per minute. So this is a roadmap showing normal levels or high levels of filtration, which is for an elder person, you expect the EGFR, which is the estimated glomerular filtration rate, to be more than 90 mils per minute. But as it declines, age could be contributory to this. If the kidney function progresses to end-stage renal disease, and you tend to find protein in the urine. So this is like a sort of a roadmap to the classification of CKD. So how do we screen CKD? The most effective way is through checking the values of estimated glomerular filtration rate, like I've discussed earlier, and that could be influenced by age, sex, and the body size. And like I said, it does decline with age. Another way to screen is through early spot morning of urine void, which after that, you need to check albumin to creatinine ratio. And there are new guidelines regarding classification of albuminuria, but I wouldn't want to bore you with that in this lecture. So what are the signs and symptoms of chronic kidney disease? We all know what the kidney does. It is very important, like the heart, it helps filters blood. So think about a lot of toxic element within your blood. These are the symptoms that patients experience, such as fatigue, poor appetite, sleep problems, headache, puffy eyes, itchy skin, feeling dizzy, feeling cold, swelling in the body, and sometimes nausea, weaknesses, and the issue of fatigue results in patients not having the desire to participate in any form of activity. Globally, chronic kidney disease affects about 8.4 million population, and it results in progressive decline in kidney function, which is associated with high death rates, high comorbidities, muscle wasting as a result of low physical functioning. Fatigue could result in that as well, and anemia and systemic inflammation. So we conducted studies about checking experiences of patients who have chronic kidney disease. We have huge lots of data, but I find this one's interesting. So one of our patients discussed what fatigue means to him, said lethargic, feeling drained of all energy, and having the need to have a jolly good power nap or sleep or boost. One of them said, I don't want to socialize because I feel too tired to be too chirpy and cheer anyone up. If I can't be cheerful, I would rather not be with anyone. Another one said, feeling tired means having a lack of enthusiasm to attempt any effort, inability to keep one's eyes open, plus a jelly-like feeling in one's leg. While you are reading through the other part of their conversation comments, I want you to reflect on what these patients, their most noticeable experience regarding their condition, that is fatigue. They feel tired because they have a lot of toxic element in their blood because their kidney is down. So our worry in terms of healthcare professionals is we focus on ensuring that there is a slow decline in kidney function, and we also focus on reducing other chronic diseases or comorbidities associated with chronic kidney disease, because it's been shown that cardiovascular disease is the major risk factor and the killer of CKD. CKD doesn't kill per se, but most deaths within the CKD population is greatly associated with comorbidities like cardiovascular disease. So therefore, the main aim and the optimal goal of treatment is to prevent cardiovascular disease events and to reduce CKD progression, which physical activity and exercise has been established to favor that. We all know what exercise is and physical activity is. They're both used interchangeably, but they mean different things. And in terms of physical activity and exercise guideline, it's been shown in terms of the recommendation that patients on dialysis have greatly benefit on exercise, especially cycling during dialysis. And that has a direct effect on the renal plasma flow, which is increasing renal plasma flow. So in essence, physical activity or exercise is vital for preventing and managing comorbidities associated with CKD. So other benefits of exercise include increasing the muscle mass, muscle strength, increasing the fitness, increasing the physical performance, also reducing comorbidities associated with CKD, Exercise has been shown to be anti-inflammatory, depending on how you tailor the exercise. And it is also shown that exercise could help reduce cardiovascular disease events among CKD patients. So in terms of physical activity guideline, the only guideline that we have there is ensuring patients aim for at least 30 minutes of moderate intensity physical activity 5 times per week to benefit health outcome. But the clinical practice guideline of exercise and lifestyle, which was published in 2021, did note that exercise should be supervised during dialysis, especially intradialytic cycling, and that would last for 30 minutes during every hemodialysis, which is a focus on moderate exercise intensity. And according to the BOG scale, within 12 to 14, and the recommendation is resistance training, using TheraBands or lifting ankle weights, and also outside dialysis time, additional exercise on non-dialysis days is recommended. So to maintain this behavior, which in essence, lifestyle behavior is the ultimate, should be the ultimate priority, strategies to encourage, to support social connectivity, goal-setting outcomes, modeling of exercise behaviors to suit lifestyle, and motivational interviewing, it has to be implemented. An exercise program should be individualized to participant needs. So this entails teamwork within physicians and other renal multidisciplinary team members, including patients, gathering patients' opinion, perceptions about exercise, physical activity, and their experience with the condition, available resources, and applying the clinical guideline as well. So I want to give you a brief of some of the work I've done in the past regarding physical activity, exercise in chronic kidney disease. So one of this work is the ADAPT CKD study, which is a randomized controlled trial study, which entails examining about 70 patients using self-reports of surveys to check levels of physical activity, physical function, symptoms perception of patients in terms of how they feel about the kidney symptoms, their fatigue level, quality of life, and their illness representations, including depression. And our key findings are, of all the 70 participants, only 26% of these are active. And there was a significant positive association between the kidney function, which was measured by the estimated glomerular filtration rate, and the physical activity levels. And also, there was a significant positive association with the physical function and the kidney function, which shows that the more active patients are, the less likely their kidneys will progress to end-stage renal disease. So, however, this is not predictive of physical activity level, physical function, or health-related quality of life. And the greater symptoms noted by this patient is feeling tired, which is known as fatigue. Other symptoms are bone or joint pain, muscle stiffness, and poor concentration. So this is another study, and that is peculiar to patients who have not established chronic kidney disease, but they have high risk of type 2 diabetes, but incidentally, we realized they had chronic kidney disease based on their estimated glomerular filtration rate, and that was in stage 2. So they had no symptoms at all, but they have they're tending to be, they have CKD, but they are in the early stage of CKD, but they have high risk of type 2 diabetes. It's a secondary study. I mean, the study is a 3-year randomized control trial, which has to do with to check the effectiveness of walking on variables. But in this project, what we did was a secondary analysis of the data which is from the baseline a year after and comparing the kidney function and the activity levels, including diet and inflammatory markers. So from these data, we found out that the participants were obese, and the eGFR, which is a measure of the kidney function, declined over the year by 2 mL per minute. However, there was no change in their level of activity, dietary markers, and inflammatory markers. There was also no association between baseline and changes in interleukin 6 and C-reactive protein. So in essence, the only significant finding in this is the fact that for a year, it showed that the kidney function of this group of people declined, despite maintaining a structured lifestyle habit, but there was no change in exercise or lifestyle habit within the control group and the intervention group. There was also no association between the kidney function and the dietary markers and the levels of physical activity. But these are for the early stage CKD patient who have no symptoms at all. So this is another study, which is an observational multi-centered study around GPs within the Leicestershire County, Leicester General Hospital and Royal Derby Hospital. And our main aim was to ascertain the prevalence of physical inactivity among this group of patients, and also to explore the correlators to readiness and confidence to increase physical activity. So this group of patients are quite different from the other project. This is more tailoring to the end-stage renal disease patients from stage 3 to stage 5. So we had 377 participants on this project, and the main age was 75 years. We have majority of females, and we observed that 58% of this population were sedentary, while only 5% were active. And of that, 35% reported not exercising and do not intend to start any form of activity. There was a positive association between how confident they were to engage in physical activity and exercise and their level of physical activity, including physical function and also health-related quality of life using validated questionnaires. There was also positive association between the readiness to exercise and engage in physical activity and the physical function and health-related quality of life. So in essence, there's positive associations between stage of change, self-efficacy, and self-reports of physical activity, physical function, and health-related quality of life in this group of patients who fall under stage 3 to 5 non-dialysis CKD. So we've been talking about patients, we had a goal about renal multidisciplinary teams in Nigeria, whereby we got opinions of doctor about engaging in physical activity. We had 400 renal MDTs recruited during one of the annual conference in Nigeria. And of all these respondents, 42% do not exercise regularly, and just 12% engage in moderate exercises. 92% agree that sedentary lifestyle is an important health risk, and 96% agree that increasing physical activity is beneficial, and 81% reported that physical activity is beneficial. So all these doctors acknowledge the importance of engaging in physical activity, the importance of avoiding sedentary lifestyle. However, from all these doctors, just 35% of the renal MDTs actually recommend physical activity or prescribe physical activity to their patients, while 17% refer patients to exercise professional, while 11% facilitate implementation. We identified specific barriers or reported barriers regarding this data, and some of the barriers that were mentioned were lack of motivated patients due to ill health, and lack of awareness of the fact that there should be exercise facilities or physical activity tailored measures to improve management of CKD. Lack of resources was mentioned as well, lack of funds, and lack of motivated staff. So we're back in South Africa. The prevalence of CKD in South Africa is about 10.7% based on the recent statistic. And the World Health Organization estimates that the burden of NCDs in South Africa is about 3 times higher than other developing countries. So infectious and NCDs are high risk, are the highest risk of developing CKD in Africa. And on looking at systematic reviews and meta-analysis, lifestyle measures have been established and are mandatory in managing CKD, but there is no exercise tailored or lifestyle tailored measure to improve CKD outcome in South Africa at the moment. In the Global South, there is no sufficient data on CKD and physical activity participation, and the prescription and provisions of physical activity and exercise in CKD lags behind other chronic diseases. Although there are established benefits of CKD, but there are also possible barriers such as lack of resources and funding as highlighted earlier, lack of motivated patients, lack of education, lack of motivated staff as well. So in conclusion, we consider the benefits of physical activity and exercise in CKD is enormous. And in order to effectively sustain physical activity or exercise behavioral lifestyle, there is a need for patient engagement and involvement in understanding the benefits of exercise or physical activity in the context of their own health and lifestyle. And not just that, there's a need to identify attainable, meaningful, realistic, and appropriate goals within that, and formulating a plan and considering managing the potential barriers I have listed above. And lastly, there's a need to monitor the progress and recognizing improvements of such interventions in CKD. Thank you for listening. I would like to address any of your questions.